Nikki?
Hi, Zach. I can hear you in my headphones.
I can hear you too, Zach.
Sorry, I'm having some video difficulties here. My program is not working.
That's okay. Just go ahead and get started. We can hear you just fine.
Okay, great. Hopefully this will hold up. So let's get started. Thank you everyone for joining us for this media briefing about COVID-19 in Idaho. I'm Zach Clark and I'm moderating today. Please remember to mute yourself unless you are speaking. A reminder that ASL interpretation is available today. Search for the window for interpreter stubs and hover over the 3 little dots to the right in the window to lock it in place. The briefing will be 30 minutes today, so we'll wrap up at 3 p.m. We'll first hear from Public Health Administrator Elke Shaw-Tulloch before opening it up for questions. With that, I will turn it over to Elke.
Great, thank you so much, Zach, and welcome everyone. We appreciate you being here today. So to start, I want to say overall it's good news for the last 2 weeks. Our case counts and incident rates of COVID-19 continue to decrease, and hospitalizations appear to be decreasing as well. Our statewide 7-day moving average of cases per 100,000 remains below 10. Our statewide COVID-19 testing positivity rate remains below 5% at just 3.6%. The percent of long-term care centers with active COVID cases is currently about 6%. I also want to say that I'm very excited to announce that we now have over half, or 50.2%, of our adults aged 18 and older who have received at least 1 dose of the vaccine. Idahoans aged 65 and older are at 76.3%. While we likely will not meet the national goal of at least 70% of adults with at least 1 dose by July 4th, we do continue to make gains in our vaccination rates, which is an important piece to stay ahead of the spread of the variant strains. We know that many people continue to be concerned about vaccine safety and are taking a wait-and-see approach. We also know that we need to make vaccines extremely convenient to accommodate people's busy lives. And because of all of this, we are employing a wide array of tactics to increase confidence in vaccine, increase access to the vaccine, as well as motivate people to get the vaccine. So just want to highlight a few of the things that we're doing in each of those 3 buckets. To increase confidence, we're doing some things as examples, such as training pediatricians and other healthcare providers about vaccines to increase their knowledge and their ability to talk with their patients about the COVID vaccine, and providing them training on motivational interviewing. We're also providing a toolkit for leaders of faith-based organizations so they can discuss vaccines with their congregations and members. We're collaborating with trusted leaders and partners in communities to carry messages about our vaccine. And of course, we're tailoring our media campaigns to address concerns about vaccine safety. To address access, a few of the things that we're doing are things like offering our provider capacity grants to help monetarily support providers' participation in the vaccine administration. We're offering mini grants for mobile special or off-site clinics, and we continue to encourage applications. We still have monies available for that, so we're encouraging anyone to apply with a community partner and a vaccine provider. And just sharing some of the creative ideas that some of the grantees are doing. So one grantee is doing something called Rock the Shot, where the provider is partnering with events like Tree Fort, Alive After 5, working with some wineries, Kleiner Park and Meridian, the Botanical Gardens, and so forth, to reach those people ages 12 and over. Events will feature live music of multiple genres of original and cover acts with local and regional performers. And it will also, through this wide range of music, the Rock the Shots program will appeal, hopefully, to a broad audience in a fun and relaxed environment to provide vaccines, as well as answer any questions about the vaccines in a non-judgmental and hassle-free way. So providers will be partnering with community members to do these events. So that's a fun way that we're working towards access through the mini grants. We're also having providers that are offering extended hours, walk-in vaccination clinics, home visits for homebound individuals, on-site clinics for businesses and community organizations. such as manufacturing and dairy sites are some examples, as well as pop-up clinics around the state. And then in addition, providers are holding vaccine clinics at community events across the state, such as rodeos and fairs, in addition to the concerts that I mentioned. To motivate people, local efforts have quite the wide variety of things that they're doing in different communities. We're seeing things like shots for shots, free groceries or grocery discounts, cash rewards from vaccinations, paid time off, points towards wellness programs, gifts, gift certificates for in-store spending, raffles, free beers, candies, coffees, pool passes, night at a resort, and etc. Some businesses are also covering shifts for their staff so they can go and get the vaccine, as well as providing discounts on insurance, providing time off work, sick days, as well as bringing the vaccine clinics on site for ease. And then surrounding all of those activities, the examples that I've shared, we're also conducting research-based messaging touting the safety and effectiveness of the COVID-19 vaccine. Reminders that the vaccine is free, it's easy to access, and also correcting misinformation. And the messages are shared by real Idahoans, including doctors, teachers, and first responders. And hopefully you've seen a variety of these out on TV. We're providing them through TV, radio, social media, including Facebook Live. We're having these press briefings, and we're responding to requests that come in, and we're also publishing information on our websites. And we do want to make sure that we're targeting our communications to providers and rural communities, and we're also creating media tools for schools and tribes that they can rebrand. The last topic that I want to cover before I open it up for questions and answers is to mention that we have our free at-home COVID-19 test kits that are now available through the Idaho Care Line. You can dial 211 or 1-800-926-2588. We want to be able to remove as many of the barriers as possible for people getting tested so we can identify cases and continue to slow the spread of COVID-19. Specifically, we worked with Vault Medical to offer free in-home saliva-based PCR tests. These tests can be used by anyone who asks for one by calling the care line, whether they have symptoms or not, or have been exposed to someone who is sick with COVID-19. For example, you can request a test if you need proof for a negative result for travel. So we hope that people will call 911 and request those free saliva-based home test kits. With that, Zach, I will turn it back over to you or Nikki to lead us through the question.
Thank you, Elke. We will now take questions from media participants. Please raise your hand in WebEx or type your question into the chat area. When I say your name, please unmute yourself and announce your name and media outlet before asking your question. And remember to clear your hand when you're done. So the first hand I'm seeing is Hayat Noramine.
Hi, can you hear me okay? Sorry, sometimes I have computer troubles.
Yes.
Okay, great. So I know there have been the federal data that came out that Kyle had reported on. What's the state doing to address staffers at nursing homes and assisted living facilities who aren't getting vaccinated? And then the second part of my question is just on the Centers for Medicare and Medicaid Services data only applies to nursing homes, as I understand it. You can correct me if I'm wrong. But what requirements do assisted living facilities have, if any, whether at the federal or state level, to report COVID cases and vaccination rates among residents and staff?
Great, that's a big question, Hyatt. And fortunately, we have Tamara Prysock on the phone, who runs our Division of Licensing and Certification. And Tamara, I wonder if you can take that question.
Yeah. Thanks, Elke. I can do that. Can you hear me all right?
Yes, thank you.
Okay. So as Elke said, my name is Tamara Prysock, and I am the administrator for the Division of Licensing and Certification in the department. And I am also the co-chair of the Coronavirus Long-Term Care Strike Team. And I co-chair that team with Dr. Marcia Whitty in the Division of Public Health. So in answer to your question, so individuals that work in long-term care facilities, they have the same right to choose whether or not they're vaccinated, just like any Idahoan does. But there are several things that the long-term care strike team has been doing to try to address any vaccine hesitancy that we see in long-term care facilities or that facilities might be experiencing. And our team has leveraged many of the resources that Elke has talked about making available to address vaccine hesitancy. We've been working closely with local public health districts to make sure that long-term care facilities have those same resources and presentations available to them to help address vaccine hesitancy in their facilities. And then also regarding the reporting requirement, the unique situation we find ourselves in around reporting is that nursing homes, they're what is called federally certified with the Centers for Medicare and Medicaid Services, or CMS. So, and they're certified with CMS in order to receive Medicare and Medicaid payments for their facility, for the care of the residents in their facility. And so CMS imposes many requirements on nursing homes in order to receive that payment. And CMS has imposed a reporting requirement about vaccines for nursing homes. So for assisted living facilities, they are not federally certified with CMS, so there is no federal reporting requirement. And unfortunately, there is also there's nothing in either Idaho statute or administrative rule that gives the department authority to require that reporting. However, the long-term care, the coronavirus long-term care strike team is working on ways that we can get voluntary reporting from assisted living facilities and exploring the possibility of maybe even offering incentives to get vaccine reporting so that we can start sharing that information with the general public. But unfortunately, we are in a position where we cannot require that assisted living facilities report those rates.
Okay, the next question will be from Kyle Fonensteel.
Thanks. This is Kyle Fonensteel from the Post Register. Can you hear me all right?
Yes.
Thanks. So I wanted to ask a two-part question about why it took us, Idaho, 2 months to reach the 50% adult partial vaccination rate, 2 months later than the nation did. I'm wondering first about the Johnson & Johnson shot pause. How many shots were administered in total, and how many Johnson & Johnson doses were administered after the pause was lifted?
Great. Thanks, Kyle. I'll start about why it took us so long, and then I'm going to ask Sarah Leeds, who's also on the call, to address the second part of that in terms of the total number of shots and the number of Johnson & Johnson vaccines. I mentioned in my opening remarks about some of the things that we're hearing from individuals across the state about their maybe apprehension or hesitancy about getting the vaccine, and part of that was really wanting to take some time and look at how things are rolling out. They need that time to, as I said, sort of wait and see approach. And so I think that's part of it. They wanted to, we know that there was significant decreases in vaccination rates across the nation after Johnson & Johnson introduced their pause. So that certainly had a ripple effect nationwide. Exactly how many people made that decision based upon Johnson & Johnson, I don't know without asking every person, but certainly it had an effect. But I'm hopeful, even though that we're kind of ticking along, we're making slow gains as people become more and more confident in the vaccine, and we have more opportunities easily available. So I think there are probably a lot of factors that went into play in terms of the slow kick up to the 50%. But again, I'm going to reiterate that I'm absolutely thrilled that we're over the hump of 50%. And I'm going to turn it over to Sarah for the numbers question.
So I am, thanks Elke, I am looking right now in our Idaho's profile in Tiberius, which captures all of the data. And we're probably going to need to get back with, was it Kyle? Kyle who answered that question with the exact total. I may be able to give it by the end of, before we wrap up, but yeah.
Okay, the next question will come from Melissa Davlin.
Thanks, Zachary. I was curious, Elke, you had mentioned going to events like rodeos and trying to do more rural outreach at manufacturing and agricultural sites. I was wondering if you could give us any insight into how successful those outreach efforts have been.
Yeah, I think it ranges across the state, of course, and some of them are events that are planned in the future, so we haven't gotten to some of those events yet. But, you know, we've seen, I will start with one shot is a success to me because that's one more person that wasn't vaccinated the day before. So I would say that as each of these events are going on, we might see anywhere from, you know, 14 doses that are given out in the course of the time the event is occurring to 50 to more than that. So it really depends on the community. It depends upon the event, all of those things. But we're not giving up, I think, is the biggest message here, that we will continue to work with our partners to make sure that we make those vaccines available. So again, to me, success is that we have, you know, we're just making those small gains over time.
Thanks so much. And unrelated second question, I was wondering, as we're seeing more cases of the Delta variant spread throughout the state, I'm only seeing one confirmed Delta variant case in Idaho. What, if anything, is IDHW doing to prepare for a potential wave of Delta?
Thanks, Melissa. And Dr. Hahn, do you want to share the questions here?
Sure. Can you hear me okay?
Yes.
Yeah. Hey, thank you for that question. We are very concerned about the Delta variant, of course. We've been following it and are concerned about the increasing reports. We have detected only one in Idaho, but we know that we are not testing every positive. You know, like most states, we aren't able to test every positive. Dr. Ball, our laboratory director, has continuously fills us in on what they're doing to try to increase the number of tests we can do, including work with CDC contracted lab. Our VA medical center is also getting stood up to help do sequencing for us. And we are able to access data from labs that are even done, some of the big commercial labs data. So we are expecting to be able to have more robust data. And in addition, we are switching from our approach. We had a meeting about this last week. As I think Dr. Ball's filled you in before, we've looked for variants mostly by looking for high risk situations. So we've asked labs or doctors, if you see a case and they just traveled somewhere, or you see a case and you get what's called that S gene dropout, that unusual finding on your PCR results, please send us those special cases and we'll sequence in them. We're going to be switching this week to requesting all positives to be sent to us, and we'll figure out a way to get as many of those tested as possible so we have a better representative sample of what variants are in the state. I'm reassured that we're not so far too far behind. We'd like to be further ahead than we are, but I'm reassured that we're not too far behind the 8 ball right now. As Elke mentioned earlier, we aren't seeing increasing cases. We aren't seeing increase in positivity. So we're not seeing evidence yet that we are seeing a more transmissible variant spreading widely in the state, but we want to get ahead of it. We want to be ready. And unfortunately, Dr. Ball's not here today. He took a few days off to go visit his father over Father's Day weekend. He'll be back tomorrow. And we'll be meeting then to talk about just the progress that's been made since last week. I think the changes have been so rapid with this concern about the Delta variant that I want to make sure I'm up to date tomorrow on how far we've gotten with getting more lab support to do more sequencing.
Thank you.
Mm-hmm.
Next question is from Shira Matsuzawa.
Hi, thank you, Zach. So, we were hearing about how we're moving in the right direction with case counts and hospitalizations continuing to decrease. And I think some people hear that and they wonder, okay, so when will this pandemic be considered officially over? Are there certain metrics that the state or the country, or I guess specifically the state, is monitoring in order to kind of make that final decision? And if so, what are they?
Yeah, thanks. I'm going to see if Dr. Hahn wants to take the bulk of that, but certainly we do have metrics that we're reviewing at the state level. that we've been reviewing throughout the course of this whole pandemic. And then in terms of the official designation of the pandemic, that's at a higher level than the state, but I'm going to let Dr. Hahn or Dr. Turner, either one, address this.
Yeah, I might start, and I'm sure Dr. Turner will have something to add. She and I both think about this a lot, and just last week we had our National Professional Associations meeting, so we had a lot of discussion about COVID and the pandemic and where it's headed. First of all, I don't think Idaho would ever declare that alone, right? It doesn't make sense for us to say it's over here, and meanwhile around us, other states are still responding. We realize that with international travel the way it is, with just even state to state travel the way it is, we can't really declare it over until the country is declaring it over. Now that said, you're right, absolutely. I totally understand. Everybody's like, hey, things are looking better and better. We continue to see decreasing case counts, hospitalizations, lab tests. Why don't we just say, hey, everybody, it's over? Well, the reason is that we know this virus is not just one virus, but it's all these variants out there. And we just talked about how we have new variants that we are detecting in the state now. We have new variants that we are worried are going to cause additional waves as early as July, August, September, maybe even before the fall flu season that we're worried about. So we certainly can't declare it over yet when we are worried about additional waves. And while we still have so many people unvaccinated. Dr. Turner, I don't know if you had any other thoughts to add.
Thanks, Dr. Hahn. I don't have anything to add other than what I would say is that we think that the numbers right now look good, but a lot of us are comparing them to where we were this time last year when they were really, really bad. But to put it in context, we don't get 100 cases of any reportable disease a day. So we're still getting a lot of case reports of this particular disease, and when we compare it to what we would normally see for a reportable disease in Idaho, it's a lot higher. So if that helps you kind of put it in perspective.
Great, thank you.
Next question is from James Dawson.
Hi, James Dawson from Boise State Public Radio. You mentioned it, Elke, at the top of your, opening that a lot of people are taking a wait and see approach when it comes to the vaccine. The numbers of vaccines administered dropped last week, and I believe DHW initially estimated that, it was about 20% of the population that wanted to take a wait and see approach. I believe that was from several months ago, but does the department have any kind of updated figures now on just how big of a slice of Idaho's population is kind of adhering to that, and has it gotten bigger than initially thought?
I don't have the data, the survey data in front of me to be able to give you the kind of those percentages right now. I would say, we continue to really try to focus not so much on that small, I look at it as a small percentage that are like no way, no how, but we do have an opportunity group, and that the wait, that I combine that with the wait and see, with the I'm too busy right now, I'll get to it when I get to it. So I feel like our responsibility is to really make that vaccine readily available wherever people are, so it's just kind of easy peasy. They're going their normal daily path and they can get the vaccine. They can get their questions answered. So I would say, without any hard numbers in front of me, I would say it's probably kind of close to the same, but we have, just from my memory, but we still have that opportunity group that we just really need to keep focusing on. Maybe part of that proportion of who's the wait and see and who's just too busy and who needs to have questions answered may change in that group over time, but we're not losing faith that we will help them out and continue to answer their questions.
Okay, well, just building off of that briefly, I guess, at what point does IDHW kind of maybe pull back from spending money on these kind of outreach efforts, whether it's radio ads, TV ads, et cetera, trying to get more people to get the vaccine if they're just not willing to do so?
Well, I think it's incumbent upon us to continue to push. We don't have a date in mind. We certainly want to make sure that as we get ourselves into the fall and winter, and as Dr. Hahn has talked about, the flu season, we need to just keep pushing and pushing for a while yet. So again, we don't have any any specific date in mind, but we'll keep, as we have the funding available to us, we'll continue to keep driving these messages forward.
Thank you.
Mm-hmm.
Next, we have Audrey Dutton.
Hi, good afternoon. This is Audrey Dutton from the Idaho Capital Sun. I am curious, two questions kind of relating to adolescents and children. When do you anticipate an emergency use authorization for children under 12? And separately, when you're talking with pediatricians, like you mentioned, Elke, what are they saying about why adolescents aren't being vaccinated in large numbers?
Yeah, thanks, Audrey. I'm going to turn that. Dr. Hahn, do you want to take that, or?
Yeah, I could start, and certainly Sarah Leeds may have something to add. First of all, regarding the emergency use authorization, Audrey, that's a very interesting question. I was able to listen to part of the FDA's vaccines and related biologics advisory committee. Related biological products advisory committee. That is such a mouthful. Their VRBPAC committee meeting and just a few weeks ago. And to my surprise, there was actually discussion about whether for younger children, instead of doing an emergency use authorization, just going right for full licensure. So I would say it has not even been completely set that it will be an EUA or emergency use for that age group. You may be aware that tomorrow, the CDC's Advisory Committee on Immunization Practices was actually supposed to meet last Friday, and then because of the Juneteenth holiday, it was postponed until tomorrow. Tomorrow, that advisory committee will be meeting to talk about COVID vaccines, risk benefit in youth and young adults, that age group that we're talking about. And I think it'll be very, very interesting. I will be participating in that call and discussion, and I think that will tell us a lot about which way the CDC and the advisory committee is heading with younger children and the vaccine. Oh, and you had I'm sorry, you had a second question that, what do pediatricians
Sorry about that.
Yeah.
What do pediatricians say?
Yeah, so it's interesting. I do have a few that I've spoken to regularly, and I will say that they are, of course, everybody's experience is slightly different, but some of them are quite frustrated that parents that they have been working with for years and who bring their kids in for all their routine shots. And of course, now we're only talking about kids 12 and older at this point with COVID, but that they are more reluctant and not as willing right now to get the COVID vaccine. And I think the pediatricians don't quite understand it all the time, but the parents, as Elke was alluding to, some of them have the sort of let's just wait a little longer. The risk that the kids don't get as sick. The things that we all are aware of. They hear a little smattering of everything. Also, though, we believe there are some pediatricians that themselves haven't been as engaged up until now, right? The vaccinees have been all adults or children that are old enough, 16, 17, that they are often presenting to a mass vaccination clinic or a pharmacy with their parent. They're not necessarily going to their pediatrician for those vaccines like younger children will certainly be doing. So I think that pediatricians themselves are in a bit of transition and just starting to really get engaged. And we are actually having a meeting with some pediatricians next week. We have the ECHO provider education series going on, and there will be one next week that we will be focusing on trying to get at this, how to make sure pediatricians are confident giving the vaccine, what are some success stories they've had talking with parents, and we will be informed greatly by that discussion that's going to happen tomorrow that I just alluded to at the advisory committee.
And a quick follow-up, Dr. Hahn, how many cases of myocarditis and pericarditis have we now seen in Idaho? I think it's been about a month since we heard last.
Yeah, the total, now as you know, and I'm going to caveat this, as you know with data, it's always a little murky. Sometimes there are reports submitted, the VAERS reports, And there's a question of whether there might have been a myocarditis, but perhaps no testing was done. So we are adjudicating or looking at every single one individually. So because we want to understand the data as best we can. We are looking at medical records if possible, and trying to make sure we understand what might have happened. Right now, we are considering that we believe we've had 7 reports of myocarditis that seem to be genuine myocarditis. So far, of the ones that we're aware of, everyone has recovered, had relatively mild. Nobody wants any kind of myocarditis. I don't mean to downplay it, but that people seem to have recovered and are doing well. But we will continue to follow this and update you all as we hear more. Thank you for asking.
And I also, I don't know if you know this, but what rate of cases or what number of cases of myocarditis have we seen in folks who had COVID-19?
I don't know that. From the question, I know you're aware that COVID itself can cause a myocarditis, as well as obviously some other very severe manifestations. And maybe that's something that Dr. Turner and we sometimes get that information when we get case reports and hospitalization reports, but not always. But we can certainly look and see what we know of what cases we're aware of.
That would be great. Thank you so much.
Mm-hmm.
Okay, we have reached the time limit, but Elke, I believe you have something you'd like to announce?
Yeah, just in some closing remarks, and I want to take the opportunity to publicly mention Dr. Hahn's national award that she won. So we can all give her a round of applause. Dr. Hahn won the prestigious Pump Handle Award by the Council for State and Territorial Epidemiologists, and we are very proud of her for her accomplishments in epidemiology and state public health. So
thank you, Elke.
You're welcome.
And I will just add that we will not be holding a media briefing on the 4th of July week because of the holiday, which means the next briefing will be July 20th at 2:30 p.m. Mountain Time. Thank you everyone for joining us today.
Thank you.
Thanks.